I'm Dr. Carroll, this is Dr. Meg, and today we're going to be talking to you about when your back goes out.
I like to say goes out because because it's such a generic term and it means different things to different people. But it is an experience that a lot of people have in very different ways. And people get very scared about it when it happens because they're in different stages of being able to move or function at all. And it hurts, so of course it's a scary time. We're gonna back it up a little bit and just talk about why it happens. And that I think is really key to understand, because typically what happens is you're going through your life and you feel fine, and you may have your occasional sensations that come up as you're going through your life, but we tend to ignore them, or we take Advil, or we just keep going and doing what we're doing. But those are important signals that we definitely need to pay attention to, because your body is giving you those for a reason. So that's the first thing. The second thing to realize is that when you bent over to pick up that pencil and then you couldn't stand up again, and you couldn't even stand up straight, and you're not comfortable sitting or moving or driving or doing anything, it wasn't the weight of the pencil that did that. It wasn't that it was so heavy that it just threw your back out. It was the fact that the previous 3 months you had been working overtime, you've been stressed at home with your family, you haven't been exercising as much as you had, you aren't eating as well, you're not drinking as much water. So all of that stress accumulates little by little by little, and your body probably did give you little cues. It was giving you some information, telling you that you should really exercise or you really need water, and we just ignore them. We just shove it to the back of our minds, right? And you know what's in the back of your mind is your spine. So your spine is processing all of that information, and that stress is building and building and building at a level where you can still function and do everything that you're doing, but you're not at your capacity. And so then it just takes one more stress, one last stress of bending over and picking up that very, very light pencil, which you've done 100 times, and that is like the last straw kind of idea. You are in this position where it feels like I was fine and now I'm not. I just took that one thing. And we hear that a lot, that I was fine. And it's important to know you weren't fine. Your body had been accumulating and managing and adapting and compensating for stress for a long time before it got to the point where it had that last stress it couldn't compensate or manage or adapt anymore. That's the first most important thing to know about it, because it's not going to go away as quickly as it feels like it came. It's going to take time. Healing takes time. And that is one of the most important principles to realize about healing, is that it happens over time, especially when it's effective healing. You have to be patient with your body. We are going to go through in a follow-up video, we're going to talk about different stretches that you can do and today we're going to talk about different tools you can use right at the moment of the acute phase. But we do want to talk about in the follow-up days what you can do to help your body heal a little more easily, get you back into your life a little faster. So the next video that we do is going to show stretches for different regions of the spine at their acute phase. But to start with, what you want to typically do, and you should always consult with your chiropractor, your massage therapist, whoever is your medical doctor, but typically within the first 24 hours, you want to alternate ice and heat. And that's going to be very helpful for the inflammation cycle that's being created by your body. So you don't want to do more than 10 minutes of each, and you want to cycle back and forth with them, and then take a break for an hour or so. And your body is going to be giving you the information you need to know in terms of movement. So if it hurts to sit, don't sit. If it hurts to run, don't run. And that may seem really simplistic, but we tend to ignore that and think, well, I really want to get my run in today, or I really have to sit and work. You're going to have to adapt and listen to your body, because your body is giving you that information for a reason. So make sure that you can ice and heat in the first 24 hours, And after the first 24 hours, I always tell people that whatever your body is asking for, if the idea of heat feels really good, then your body wants heat. If the idea of ice feels really good, then use ice. But there isn't a universal thing to do at that point. At that point, you want to do what your body needs. And we're all individuals. We're experiencing the stress in unique ways. And so you may need ice, I may need heat. So listen to your body again. You're going to hear that a lot from us because we know that the body has this incredible innate, which is a chiropractic term describing the inborn wisdom of your body. And that information that your body is giving you is really key to listen to. Dr. Carroll is going to talk about some other tools besides chiropractic that you can utilize in that acute phase.
So one of the things that Dr. Meg has said so clearly is listening to your body. And so one of the things that is really important in terms of that movement idea is to do stretching and movement to the point of where you start to notice something. So movement is key, but also during that same process to rest when you can. Let the body come back into a state of ease. Breath is critical. Your breath changes the movement of the fluids of the body, and it really affects the discs, which are the spacers between the joints of the spine that affect the nerves. So you want to really gently breathe when you change positions. One of the things that I find is it's just natural to sort of bear down and hold your breath as you change positions. That will put pressure on the disc and on the nerves and on the fluids of the body. So you want to just let the breath come through your body with ease. Both inhale or exhale, it doesn't matter.
Also, if you regularly see an acupuncturist, they usually have a cupping technique they can do, which is really helpful in that time. If you have a massage therapist that you see, I recommend, if you're comfortable laying on a table, then go see them. If you can't lay comfortably, then you need to wait probably at least a week before you go see a massage therapist, but your body will let you know when you're ready. But those practitioners are people who can help you in those times. You may need to increase frequency. Oftentimes when we have people who come in on a regular basis, when they go through an acute episode, they need to come in 2 or 3 times a week to get their adjustments as they work through that process and get back to a more functional place. Your frequency may need to change as you go through this with people that you're regularly seeing. If you aren't seeing any of those people, I would recommend starting, obviously I'm biased, but I would recommend starting with a chiropractor because they can do an assessment of your entire body and your entire spine and really give you a recommendation of the very best thing that you can do to take care of yourself. In terms of at-home care, you can use topical things on the area that you're feeling the symptoms. We have a product here that's called China Gel. It's kind of like a BioFreeze or an Icy Hot. That's a good product to use as long as it's okayed by your primary person that you see or your chiropractor or whoever, your massage therapist. You want to check in with them first before you use anything like that, but that can be a very helpful interim product to use in between seeing your therapist for getting work done on your body to allow your body to heal. Chiropractors often, or massage therapists or different practitioners that you may see, can use a taping technique. There's a lot of different techniques that you can use that help with inflammation, that give the body support in the areas where you're feeling the pain. So there's a lot of things that we can do to help you recover faster and get to a more functional place. And so you want to utilize those practitioners in your life because they will help you. And there are things that you can do at home. And like I said, we are going to go through in the next video the stretches for when your low back goes out or your mid back goes out or your neck. So we're going to go through each of those sections in the next video so that you can have more things that you can do for yourself at home. Thanks for tuning in. We'll look forward to seeing you next time.